Hi everyone. I am re-recording the administration of medication lecture because there was no sound. So I'm very sorry about that. I'm going to get this done tonight so I can get it all out to you. And we'll go ahead and proceed with our lecture. So, introduction to administration of medication. We start with some definitions. So pharmacology is the study of drugs. That includes the preparation, the use, and the action of drugs in the body. And a drug is a chemical that's used for treatment, prevention, or diagnosis of disease. So treatment, we might give medication for hypertension treatment. We might give cholesterol medication to prevent heart attack or stroke. Another medication that we would use to diagnose is some type of radio-opaque chemical that we would use like an X-ray, like some type of contrast to help diagnose a problem. So most drugs are produced synthetically, meaning they are man-made. They can be obtained from animals. Medications such as Synthroid. Synthroid is a medication that is given for patients who have thyroid disorders. Plants, we get penicillin from plants. We also get aspirin and Sudafed. If you're like me and an allergy queen, Sudafed is my friend. Another example where medications can be produced from or obtained from is minerals, like iron. Patients who have anemia or that low blood count might take iron to help raise their hemoglobin level. Zinc is another mineral. We use that a lot on wounds and eczema. You might see zinc in sunscreen. In the office, medication can be given 3 ways. So it might be administered, so you give it to the patient while they're in the office. A couple examples are Kenalog. Kenalog is a steroid. We will give that a lot of times if patients are having a lot of some type of allergy or some type of inflammation. Toradol is another medication that we give in our office a lot. It's a pain medication that's given as an intramuscular injection. Sometimes patients are given a pill because their blood pressure is too high while they're there. Prescribed medication is where the doctor provides the patient with a handwritten or a computer-generated prescription that they fill at the pharmacy. It might also be called in by phone or faxed to the pharmacy. Antibiotics are a great example of that. When you go to the doctor and you're sick and they give you an antibiotic, maybe for a strep infection, that's a good example of a prescribed drug. Dispensed is a medication that's given at the office for a patient to take at home. Drug samples is a good example. So I mentioned that Synthroid or thyroid medication, that might be one. A lot of blood thinners, especially a lot of the new ones that you see on TV like Xarelto or Eliquis, Pradaxa, those are all blood thinners, and those can be very costly to patients. So a lot of times they can get samples of those that are kept in the office. And someone needs to monitor those drug samples. So there's usually a logbook. You make sure you record the lot and the expiration date. Somebody needs to make sure that those don't go expired. So legal aspects. So we only want to, as medical assistants, administer medication under the direction of a physician. So it's unlawful to administer medication without a physician consent. Sometimes that includes making sure the provider or the physician is in the office building before you give a medication. Maybe someone's coming in for vitamin B12 injections. That might be an example of that. Routes of administration. My page too soon, sorry. Oral medications are given by mouth. That's the most common way patients take medication. Sublingual is given under the tongue where it dissolves. Inhalation is the inhaler. Rectal might be, or it is a medication that's inserted into the rectum and dissolves. Vaginal is another example. So if we talk about oral medications, we all know tablets and capsules can be taken that way. Sublingual Nitroglycerin, it's a medication that's given for chest pain. That is an example of a sublingual medication. There's another antiemetic. So one that is an antiemetic is something that's given for nausea and vomiting. Zofran or ondansetron is an example of that. Rescue inhalers like albuterol. Rectal Tylenol can be given that way. Vaginally, estrogens are given, or yeast medications. Sorry, went the wrong way. Topical is like a cream where you put a cream onto the skin. Intradermal is just under the epidermis, and it goes into the dermis. That might be like the TB test that you all got before you started class. Subcutaneous, that's into the fatty adipose tissue. Insulin is an example in diabetic patients. That's given subcutaneously. Intramuscular is IM. Vaccines are given that way. We talked about that Toradol and Kenalog as well. Intravenous is IV, so into a vein. Antibiotics might be given that way, or fluid might be given that way. So the route of administration, that really depends on the type of drug, the dosage form or what's available, the intended action, so what's the goal of giving this medication, and how rapid the response you want to achieve. So is this an emergency situation? Can the patient wait, or do they need it right away? So the most common routes of administration in the office is parenteral, which refers to sites located outside of the GI tract. It's most commonly used to refer to administration of medication by injection. So patients come to the doctor's office for allergy shots. They come in for vaccines. Those are examples of how medications are given parenterally. For drugs that are used in the office, the medical assistant must be familiar with indications. So why are we giving it? Adverse reactions. The route of administration, so how are you going to give that drug? The dosage that you give, how many milligrams, for example, and then how to store it. So it's important to know these things so that you can safely take care of your patient in the office and watch for anything abnormal and just make sure that you're being safe with your medications. The package insert, so the manufacturer includes a package insert with each medication. It comes with sample drugs, it comes with injectables, and it contains as much information as you could possibly want to know on a medication. So something that you could do is you have a medication like a prescription, like I know eye drops or nose sprays, inhalers come with those. You could look at a package insert, or if you want to Google a package insert for Tylenol just to see what it says, you can see what kind of information is available on the medication. A PDR, or physician's drug reference, is another way that you can get information or reference is another drug reference. This contains information on major prescription pharmaceutical products that are available in the United States, and it consists of an actual drug package insert. PDRs aren't really seen much anymore. I know there are offices that still have them, but there's so much available online that usually isn't available. So the Food and Drug Administration, that's a federal agency for the Department of Health and Human Services, and they're responsible for following medications and making sure that they're safe for human use. So any kind of new food, drug, a vaccine, any kind of medical device, like maybe a pacemaker, and cosmetics. A joint might be another example, like if someone gets a hip replacement or a knee replacement. And they, follow these new devices and new vaccines, and they may recall them if they have been found to be harmful or defective. So they play an important role in the medications. They determine the safety and effectiveness of medications that are either by prescription and OTC or over-the-counter. It can take years of testing of a drug for that safety and effectiveness to be determined. The drug manufacturer must submit an application for a new drug to the FDA, and a patent takes about 8 years, and it's good for 20. So they submit a patent or an application for review, the application for review and approval to get the patent, and that has to be completed before the drug can be released for any kind of patient use. The FDA also determines if a medication can be available with or without a prescription. So a prescription must contain the following label. The federal law prohibits dispensing without a prescription. So a lot of times, I was watching the other day, and there's an eye drop called Pataday that's for allergies. That has been available by prescription, and now you can purchase that over the counter. I know like Flonase and Nasacort, a lot of those nose sprays are now available, so they can help determine if that can be safely used by the consumer or the patient without having a prescription from the physician. The FDA also determines if a medication, we talked about that, with or without a prescription, they help determine that. So for that to happen, for a medication to be determined safe without a prescription, it has to have a low incidence of adverse reactions when used properly. So mild pain relievers like Tylenol or Advil, topical antibiotics like bacitracin or triple antibiotic, Neosporin that you use, topical corticosteroids, an example of that might be hydrocortisone cream, cold medicines like some type of decongestant, and then laxatives like Imodium. So it's just something that they, again, have to prove that's safe for use. So a medication has 4 names when we look at the names of drugs or drug nomenclature. So it has a chemical name, a generic name, an official name, and a brand name. So you are going to pay attention a lot to the generic and the brand. Let me go back. The chemical name is the precise description of a chemical composition. The generic name is assigned by the manufacturer who developed the drug. So it's often a shortened derivative of that chemical name. So you'll hear a lot the generics. Those are usually cheaper. The official name, that's under which the drug is listed in official publications. So like in the Pharmacopedia, it sets standards for each drug to regulate the strength, purity, packaging, safety, labeling, dosage, and the generic name that's frequently used. The brand name, again, along with the generic name, that's things that you'll hear a lot more. And take a look at things that you have at home, like Tylenol or Advil, ibuprofen, and just see what you can find on those labels. And all of that official name of the drug, that all of those standards to regulate help set standards for safety of that medication. Okay, so the brand name, that's the name under which the pharmaceutical manufacturer or pharmaceutical company markets the drug. It can be marketed by more than one company. So a generic drug might have several names. So if we look at acetaminophen is Tylenol. We know Tylenol is a brand name. We might hear Advil or Motrin for ibuprofen. You might hear Bayer or Ecotrin if we talk about aspirin. You might hear Amoxil for penicillin. So those are just some examples of generic and brand names. So brand name would be Tylenol. Generic name would be acetaminophen. Brand name would be Advil. Generic name would be ibuprofen. Brand name would be Amoxil. Generic name would be penicillin. That's an antibiotic. And then Bayer would be the brand name. Aspirin would be the generic. Again, be familiar with the generic and the brand name. Those are most prescribed and what you're going to hear more. The classification of drugs is based on the preparation, so liquids or solids. Antibiotics can come in both liquid and solid. Kids, they might get some type of liquid antibiotic, and adults will get the solid. They'll get a tablet or a capsule. That's talked about a little bit more here. So it permits the administration of different types of patients. So lots of us are going to need antibiotics at some point in our life. So young kids might need the liquid, and older adults or children might need tablets or capsules. An elixir, that is a drug dissolved in alcohol and water. It's often sweetened and flavored, and Dimetapp is an example of an elixir. You can get that over the counter. The brand name of Dimetapp has been discontinued. Tylenol can be another example of an elixir. I think with Dimetapp, there's a lot of things to pay attention for. It can make kids drowsy or nervous, unable to sleep or dizzy. So I think that's why they took the brand name, but you can still purchase that as a generic medication. Emulsion, that's another liquid preparation. It's a mixture of fats or oils in water. So it's important, we're going to talk about a lot of these liquid preparations. They're all kind of I don't want to say one and the same because they're all a different mixture, but they're all going to be some type of liquid. And it's usually they're going to have what type of liquid they are in their name. So Uresol, that is an eye drop that can be used to treat eye pain and irritation, inflammation after surgery. They can be in an emulsion, can also be like a gel or cream. This is just a liquid preparation of an emulsion. Liniment, that is combined with oil, soap, alcohol, or water, and it's applied externally using friction to produce heat or warmth. So an example of this heat liniment, another thing you might think of is Bengay. A lotion is an aqueous preparation that contains suspended ingredients. It's used to treat external skin conditions. It provides some soothing, some moisturizing help to the skin. It can also destroy harmful bacteria. So Caladryl lotion, you might remember, I remember that from when I was a kid, to treat poison ivy or insect bites. That's an example of a lotion. A solution contains one or more completely dissolved substances. So we talked about solute and solvent before. So solute is the dissolved substance. Solvent is the liquid in which it's dissolved. Most of these types of medications are administered by injections. An example of this is Depo-Provera. Depo-Provera is an IM medication or intramuscular medication that is a contraceptive that's administered in the office. A spirit is combined with an alcohol solution that's volatile, so it evaporates readily. An aromatic spirit of ammonia. An example of that is the smelling salts that you might give to someone if they've passed out in the office. A spray, a fine spray of medicated vapor, Dristan nasal spray, that is also known as Afrin. Afrin is important that you don't use more than 3 days because it can have a rebound effect and actually cause a worsening of your condition. That can be used for colds and congestion, but that's one of the medications that's over the counter you just need to be safe with. often used for throat and nose. A suspension is a drug that contains a solid, insoluble drug particles in a liquid, so it must be shaken before you administer it. So amoxicillin oral suspension, amoxicillin is an antibiotic. So when kids get that, the parent would want to make sure they are shaking that medication really well to make sure it's getting all of those particles evenly distributed. They get a good dose of their medicine, or the correct dose. A suspension aerosol, it's a solid or liquid drug particle suspended in gas. So it's dispensed as a cloud or mist. Proventil is an example of this. Proventil is a medication that's used for lung disease like COPD or asthma. If you've heard of a nebulizer, that's an example of an aerosol, or an inhaler is another example. A syrup is dissolved in sugar, water, and flavoring so that it disguises the unpleasant taste. An example of that is Robitussin or Delsum is another cough syrup, for example. Tincture is dissolved in alcohol or alcohol and water. An example of this is tincture of iodine. That's an antiseptic, and if we remember our antiseptic properties, that's something that's important in preventing infection, but it's applied on the skin. It's used sometimes before procedures just to make sure that the skin is clean and free from any bacteria or pathogens. A tablet, that's common to everybody or known, a powder drug that's been pressed into a disc. Some of those are scored. So if you see an indentation right down the center of the tablet, it can be broken into halves or quarters to make sure a patient is getting a proper dosage. Tylenol, if you looked at a regular Tylenol tablet, that would have it. Not a capsule, but a tablet. A chewable tablet, that's a powdered drug that's been pressed into a disc. It's often used for antacids, antiflatulence, or children's medications. So Pepto-Bismol, Tums, you think about kids like ibuprofen and Tylenol, they come in chewable preparations. You have to be careful with those because they can taste like candy to a child and they just want to eat the whole package, which would not be safe. So that's why there's warnings on kids' medications. You want to keep them up and put away. A sublingual tablet, that is a tablet that's it's a powder drug. It's been pressed into a disc as well, but it dissolves under your tongue, and it dissolves and rapidly absorbs into the bloodstream. Nitroglycerin sublingual tablets is an example. Nitroglycerin is a medication that is given to patients who are having chest pain. So if someone comes into the emergency room, they might give them nitroglycerin to help their heart. They would probably give it IV though. Well, just depends on the situation, but patients can keep those at home with them, and if they have chest pain, they can put a nitroglycerin under their tongue. The goal is to constrict the vessels to help with chest pain. A patient can take one, they can repeat it in 5 minutes. The problem though is it can drop their blood pressure. If their pain is still present, they can repeat that. And they can wait another 5 minutes, repeat it a third time. If their pain is not resolved by that time, they need to be calling 911 or getting to the emergency room. Zofran or ondansetron, that's another one that I mentioned earlier. That's an antiemetic for nausea and vomiting that can be given as well. Enteric coated, that is coated with a substance that prevents the tablet from dissolving until it reaches the stomach. It prevents the drug from being destroyed by the gastric juices so that it's not irritating to the stomach. You can't crush or chew these because it releases those active ingredients into the stomach prematurely. So enteric-coated aspirin is an example, or naproxen. Those are both, it can be given for pain. Often aspirin is a daily medication where you give a baby aspirin, 81 milligrams. And it's given daily for a lot of heart patients. A capsule is a drug contained in a gelatin capsule that's water soluble, and it prevents a patient from tasting the drug. An example of this might be Benadryl. If you get a Benadryl capsule, it might look like this. Sustained release, they contain granules that dissolve at different rates. So you might have seen a pill that's maybe clear on one side, or both of the sides of the capsule is clear, and you can see those little granules, and it provides a gradual and continual release of the medication. So it reduces the number of doses someone has to take. The example they give here is Contact 12-Hour SR, which stands for sustained release. There are some other medications. Some pain medications are sustained release, some blood pressure medications, and seizure medications also. So they're getting that gradual and continuous release of medication. A caplet is a drug contained in an oblong tablet. It's smooth, helps patients swallow those easier. Advil is an example of that. Again, Advil is a pain medication or over-the-counter. A lozenge, that's a drug contained in a candy-like base. It's circular, dissolves like a cough drop, or a throat lozenge would be example. Again, candy-like, so it's important to be careful with children. A cream is a drug combined in a non-greasy base. It's semi-solid and applied externally. Hydrocortisone is an example of this. That is something that you would use for like itching, rashes, things like that. An ointment is oil-based, so it's semi-solid as well. It's usually more greasy, and you can apply it externally to the skin. It's usually more clear than a cream. A cream is usually white. Corticosporin, topical ointment. Corticosporin is like an antibiotic ointment that you can use. A suppository is a drug mixed with a firm base like cocoa butter, and it melts at body temperature. It's shaped into a cylinder. One end has a cone shape to it. That way it can be easily inserted either into the rectum or the vagina. Preparation H for hemorrhoids is an example. Tylenol can be given as a suppository. Some of those antiemetics or medications for nausea and vomiting, those can be given as a suppository if patients aren't keeping food and fluids down. I say Tylenol, that's an example. A transdermal patch has an adhesive backing that contains the drug. It's applied to the skin, and after being absorbed in the skin, then it enters the circulation of the body. Nitroglycerin, we talked about that nitroglycerin for chest pain. Sometimes that comes in a patch. Another example is a nicotine patch. Those can be irritating to the skin, so that's important to pay attention to. For the patient, they need to make sure that when they're wearing patches, they're rotating the sites. Nicotine can cause some dizziness, racing heart, sleep problems, headache, nausea, muscle ache, and stiffness. So those are just some examples if someone has a nicotine patch, things to pay attention to. So classification of drugs based on their action. So that's how drugs are classified. Common drugs administered in the office. So category, which drug it belongs to, the primary use, and the major therapeutic effects. There is a table on table 26.1 in your book. If you review that, that gives you some classifications of drugs. I would encourage you maybe to make some flashcards that would help to learn those. I will stop here, and we will move on to the next section.